Welcome to the Compounding Center Connections, where we talk about different health conditions with our partner practitioners. I'm your host, Jay Gill, from the owner and a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom compounds to make our patients get better. In today's episode, I have Dr. Theodore Kim from Allergy Partners of Northern Virginia, located in Chantilly, Virginia. Today, we're going to discuss about oral immunotherapy. But before we start, Dr. Kim, could you introduce yourself to the listeners and the viewers?
Sure. Hello. Good morning, Jay. Thank you for having me. My name is Theodore Kim. I'm an allergy immunologist at Northern Virginia. Our office is located in Chantilly, Virginia, and we practice full-time allergy, asthma immunology patients, and also offer what the topic of today is called full oral immunotherapy. Thank you.
Thank you. So let's just dive right into it. So Dr. Kim, we have made certain medications, compounded some medications for your patients, and one of the most interesting ones is oral immunotherapy. Could you tell to our listeners what is oral immunotherapy?
Sure. Oral immunotherapy is a desensitization process where food is given in small amounts in increasing doses to increase patients' threshold of activity. Okay? So remember, it's not a cure for food allergy, but it can provide real and substantial protection from a life-threatening anaphylaxis, like anaphylactic reaction. So currently, the standard of care for food allergy is avoidance. Okay? And so the treatment of accidental exposure, ingestion of peanuts, for example, the treatment of epinephrine is anxiety-provoking and perceived by patients' family as quite challenging. And so quality of life is significantly affected. And so to give you an example, one study, when a patient was diagnosed with peanut allergy, at 5 years follow-up, 58% of those patients had accidental ingestion of peanuts. Okay? And at 10-year follow-up, 75% of those patients have accidentally ingest peanuts. And so the main goal is to have a normal life where you can enjoy going to restaurants, baseball games, without having to, or birthday parties, without having to worry about accidentally ingesting peanuts. And so this is quite effective, and OIT has been around for many years, past decade, with robust studies in research academic centers. And recently, the OIT among private allergists has expanded for several years. But still, the availability is limited due to distance, and so at this point, the OIT is not currently a standard of care yet, but I think it will be very soon.
So, for our listeners and viewers, I know we make a lot of peanut capsules for your practice, for your patients, and you're an expert at this peanut protocol that you have. And essentially, you're trying to desensitize a child or a person that has peanut allergy in small increments, micro amounts, and then increase to those peanut protein allergens that cause the allergy in higher amounts until a certain point. Now, wasn't there an FDA approved drug, Palforzia, that's also about regarding the peanut immunotherapy?
Yes, there is. And so the Palforzia has been approved by the FDA for to increase threshold reactivity in peanut allergy patients in January 2020. And these are essentially a highly purified proteins in capsule form. Okay? And the protocols are very similar to what we do with our peanut flours and actual peanuts. But those are, the main difference is at end of the maintenance dose, which I'll go over in a few minutes, the stages. the pathologia, one capsule is about equal to a bit over a peanut a day, and that's their maintenance dose. The food OIT that we provide and other private practitioners provide can go up to 8 peanuts a day, typically. So that's the main difference.
Gotcha. So if a parent was to consider this therapy for their child, you know, they know that the child is allergic to peanuts, and starting on this therapy, are there any side effects, any concerns?
Yeah, so yes. So first of all, the OIT is developed for peanut allergic patients who typically are 4 years and up. And so there are other allergists who have provided food OIT to younger patients, but 4 years is a age we use. And the main reason is so that a child can be able to, child's able to communicate to us if they're having any reaction. And so, and 4 years and up, typically. So this is not for everybody, of course, but the basic main criteria is if you have truly peanut allergy, then you qualify for this treatment.
You were talking about side effects, or perhaps, you know, what are the risks associated with this, starting this therapy?
And so the risk of developing anaphylactic to this the program is actually quite low, okay? And so one thing you're about is anaphylaxis, because what we are giving you is what you're allergic to, right? And to desensitize. And so one study showed that those are 2 phases actually. I should go back to the phases first before talking about side effects and risks. Let's talk about the protocol. So you come in day 1 and spend about 3 to 4 hours increasing micrograms to milligrams of food protein every 15 minutes. Okay. After the last dose of that dose that day, go home on that dose on a daily basis at home. Okay.
Okay.
For example, 2 milligrams of peanut protein, typically. Then you ingest those at home every day. Then you come back in 2 weeks to updose. Okay. So updose to 4 milligrams, for example. And then you observe for 45 minutes. Then you go home on that dose for 2 weeks. So every 2 weeks, you're coming in for the updosing. Okay. It takes about 10 months, typically. Okay. And after the 10-month period, you will hit what's called maintenance dose. And that's the last dose you'll be taking. And you'll be on the maintenance dose at home on a regular basis indefinitely. So if you're not, for example, peanut OIT program, you'll end up in 8 grams a day of peanuts. That's 8 large peanuts a day. Okay? And so then you're on maintenance dose, and that has to be maintained to be protected from anaphylaxis due to accidental exposure. You can do further challenges, and most kids can, patients can eat peanuts freely on top of the 8 grams a day. Yeah. And so that's kind of the protocol you're looking at. In studies, you can look back at the studies in terms of how often does anaphylaxis occur. One study showed that per 1,000 doses, now patients are dosing on a daily basis. And so 1,000 doses, that's this group of patients really, you know, in the center. 0.7 chance of using epinephrine due to anaphylaxis per 1,000 doses. This is very uncommon to have anaphylaxis.
Okay.
During maintenance phase, that number becomes 0.2 of 1,000 doses. So anaphylaxis are quite uncommon. Now, side effects do occur, okay? And these are local side effects as you ingest the peanuts, for example. Those are abdominal side effects, GI side effects can occur 10 to 20% of the time. So those are not an anaphylactic reaction, but it's a side effect due to ingestion of peanuts. And those can be mitigated through various treatments. Okay? Most kids can get through it without problems. Another side effect risk is all across the board of peanut, tree nuts, milk, egg, wheat, soy. Through a meta-analysis, 2.7% of patients who undergo OIT can develop what's called eosinophilic esophagitis. And that is an inflammation of the esophagus causing vomiting, projectile vomiting, and abdominal pain, and so forth. Okay? So those can occur. And if those occur, then that's the reason to stop the OIT. Those are the main side effects.
Okay. So a couple things. That is it. Adults can go through this therapy too, right? Or or is it just usually kids?
Usually kids do well, but adults, it's not contraindication for adults. We talk
Okay.
to adults if they wish to go through the program, but majority are 17 and under.
Gotcha. Okay. Now that's pretty interesting. That for the maintenance dose, they for the rest of their life are on 8 peanuts or more. So that's I did not know that myself. And one of my questions was, how long is the therapy? But it's practically indefinitely that you have to be on this maintenance dose of 8 peanuts, right?
As of now, yes, I would have to say indefinite. However, after on a periodic follow-ups, 6-month annual follow-ups, we do look at the numbers, the test numbers for peanuts or other foods. And then if those numbers go down, we can find out whether a patient has, quote, cured or outgrown. And that term we use is called sustained unresponsiveness. It's a term the allergists use. So that once the numbers are low enough that perhaps they may be outgrowing it or no longer allergic, we can do a challenge after a period of avoiding peanuts for 1 or 2 months. Then when you re-challenge them, if they pass, then we consider them to have sustained unresponsiveness. And that is effectively a term we use. We can't truly use cure, because it's not really a total cure, but this can be done each year as we go through the process.
Gotcha. So, Dr. Kim, now this protocol that you have used, could you share with us like how long you've used it and like what's the success rate, and are there any failures also?
Yes. So as I mentioned, the risk of anaphylaxis is quite uncommon. However, if you look at the studies of OIT, across all the food that has been done, such as eggs, milk, tree nuts, soy, and others, approximately 85% make it through. They're successfully desensitized. The 50% of patients who do not go through, they drop out mostly due to side effects, the abdominal GI side effects. And also along the way, there's aversion to the peanuts. As they ingest the peanuts on a daily basis, they may have issues with taste and so forth. And so about 85% up to 90% probably go through the process through the desensitization program.
Dr. Kim, can you share like a success story with a child? So, how the child's life has changed and the parents too. Can you share a success story without sharing the names or anything like that?
Of course, yeah, absolutely. And you have a 10-year-old patient, any between 5 and 10-year-old patient comes in who has had anaphylaxis due to accidental exposure in the past. And so you go to a party, ingest some treats or goodies, and notice that you ingested peanuts, develop anaphylactic reactions, have to have EpiPen, and go to the emergency room for further evaluation and for observation. And so the avoidance of food is actually quite challenging for families. You cannot have a normal life. You cannot go to restaurants freely. You cannot go to baseball games, parties. If you go to birthday parties, you have to bring your own cake because you cannot eat the cake from the families hosting the party. And so their life is quite limited and it's very highly anxiety producing to go through through life where they always worry about accidental exposure to peanuts. And so they come in, you go through the process. I do screen patients. It's not for everybody. And so we talk with the patients and parents and and talk about all the goal of immunotherapy, what's involved, and once you start, it's pretty successful because we're giving peanut protein in a controlled fashion, that the anaphylactic reaction is quite low and it's quite safe. And so there's a phase where we give, first day we give liquid peanuts in a solution, and then after they finish day one, they go home on peanut capsules. Thanks to you, Jay, and the compounding center, that we were able to rely on highly, reliable amount of protein capsules, powder form, and that take that home with them and then do their process. About 24 weeks, they go through the capsule process, and after that, they transition into actual peanuts. 1 peanut, 2 peanut, 3 peanuts every 2 weeks. And so once they go to hit the peanut stage, I see a lot of parents, because it's a significant milestone during the process. They're actually able to eat peanuts. And I see a lot of moms, dads, especially moms, they cry because they're so happy that they can't believe their child's eating peanuts, and they're fine. And so, and then when they graduate, 8 grams a day, and it's just life-changing. Significant life-changing for the family, because they no longer have to worry about having anaphylaxis when they go out. So,
wow.
Yeah. This is a classic, pretty much everybody that does.
That's great. Thanks for sharing that with us. Now, what would you say to a parent who is listening to this and is just undecided and just is unsure and maybe even worried about that might have an anaphylactic reaction or something? What would you say to that parent about this therapy?
Yeah, so it's safe. This data on OIT has been done. There's robust data out there for the past decade in research centers and among the private allergists who offer OIT. The safety is something that they shouldn't worry about too much, and we go through the process with them day by day, and it's anxiety-provoking process, of course, but I think it's a life-changing event. And what we do is we do have what's called, we have consultation before they begin the OIT program, and we go through the process in very detail. We answer all the questions they have. We give them handouts to read about OIT, and so it sets parents' mind at ease in terms of what they have to worry about.
Okay.
There are some considerations, by the way, with OIT, and that is that people should know when you dose peanut food dosing, you cannot exercise 1 hour before or 2 hours after dosing. The exercise can cause high-risk anaphylaxis. You have to dose with a full stomach or after a meal, and you have to skip when you are ill with illness or viral illness. But those are easy to control, and those are some considerations that parents may want to consider, because it may limit some sports activities in some cases.
Okay. Well, Dr. Kim, thank you very much for sharing this information with our viewers and going through the whole process of how this therapy takes place. If someone wants to make a consultation with you, how would they reach you, or where can they reach you or contact you?
Sure. They can call our office at 703-378-5155. My name is Theodore Kim. You can Google, we're on Google. If you type in Google, Allergy Partners, Northern Virginia, and make your first appointment as a new patient. And we'll establish at the first visit whether the severity of allergies of the peanuts or other foods. And after that, you go through another process of that full consultation for OIT only. In that appointment, what they do is I spend up to 1 hour face-to-face with parents and the patients, go through all the process of OIT in very detail, so that they have all the information they need before deciding on going forward with this treatment.
Okay, well, we're going to make sure that the contact information is in the description of the video and the podcast. I also want to make a disclaimer that this information today presented to you is just for information purposes only, not for treatment or diagnosis. And I am Jay Gill, and I can be reached at the Compounding Center in Leesburg, and my email address is j@compoundingcenter.com. Feel free to reach out to me for any comments or questions. Thank you. Thank you, Dr. Kim.
Thank you very much.